Hi, welcome back to Academy Animal Hospital. I'm Dr. Michelle Cahill. So just continuing our discussion about geriatric care, and something that comes up literally quite often are lumps and bumps in our older pets. So how do you know when those should be looked at, and how do I decide when those should be removed? So most skin bumps that dogs get tend to be benign, not always, but tend to be. And so I like to look at them really anytime an owner is concerned about any new lump or bump. So definitely anything bleeding, anything that comes up very quickly, any lump that's really hard, or and definitely absolutely any skin growth that's on an eyelid, especially if it's growing into the eye and rubbing on the surface of the eye. Anything like that I want to see pretty quickly. And with an elderly cat, skin bumps on cats aren't quite as common, so I really want to check those just as soon as you notice any lump or bump that is new on your elderly cat. So how do I decide if we need to remove those? Well, a couple of different ways, sometimes just by the appearance. But usually I'll just take a syringe with the needle attached and actually insert that needle into the bump, pull some cells out, and just look at those under the microscope, and that helps me determine, is it something completely benign, like a fatty tumor, or a papilloma, or like a sebaceous cyst, or is it something we actually do need to remove? And when we do remove a lump or a bump, I always send that in for a biopsy, because if it's worth taking off, it's worth finding out, what it is. Especially because if it is something bad, like a mast cell tumor, we need to know that, because your pet might need some care in the future. If it is a cancer, malignant cancerous mass. So that's kind of lumps and bumps. Like I said, most of them are benign and purely cosmetic. And now there are some different ways we can actually remove those that don't require general anesthesia. Say if it's like a little papilloma and it's just not very pretty, and it's a dog that gets groomed fairly often and it's getting caught on the clippers. If it's fairly small and they're a good dog, or fairly calm dog, we can just remove those by putting a little lidocaine around them and just by getting it off with the electrocautery unit or the laser. Now, sometimes those bigger bumps that are more extensive, they will require general anesthesia, but we try here to, tailor the anesthetic for an elderly dog to make it absolutely safe as possible. So that should cover lumps and bumps. Like I said, you probably noticed the pictures you saw last week from the elderly dogs we posted on Facebook. Most of those dogs had a few lumps and bumps here and there. So that's it for this week. We'll continue this discussion about geriatric care next week, and thanks so much for joining us. Bye-bye.